Great, thank you, Andy, and good afternoon, everyone. I'm delighted to be here on behalf of all of the authors of the Environment, Health and Wellbeing chapter to give you a bit of a taste and a flavour for what's in our chapter. So it's very broad-ranging, I suppose, given the very nature of the topic. So I'm not covering absolutely everything that's within the chapter today, but just to give you a sense of some of the key items that are emerging from it and how they link with the three key messages, I suppose, is the most important thing. And to start with that, so the first message from the chapter is that our health and well-being is inextricably linked to our surrounding environment. So the fact that if we can reduce our pollution, adapt to mitigate climate impacts and restore ecosystems, this can have enormous benefits on our health and well-being. And we really need to prioritise the implementation of solutions that can address multiple of these issues all together at once. The second one is around, and what we've heard a lot about already today, is that environmental exposures causing disease and early death are modifiable. So they're within our power to actually change these. They are, in the main, preventable, modifiable. So people can be healthier and live longer when we address some of these issues such as air and water quality, noise, radon exposure, chemical exposure. The last message then is around the impact of environmental hazards and exposure, the fact that they are not equal across society. Some sectors of society are more disproportionately impacted than others. So I'm going to link with some of those messages throughout the chapter. The first one being the importance of a healthy environment. So the state of the environment can influence our health both positively and negatively, and you can see here in the yellow the 6 core needs that we need for health and well-being and how they're impacted then by our built environment, our natural environment, and our consumption, our behaviour. So the benefits of a healthy environment, there's an inextricable link there between the health of our environment and our own health and well-being. So harm one and you harm the other. Contact with our natural environment can cause many benefits to our health, including physical activity, better mental health and well-being, stress reduction, and then social cohesion and connectedness. But it also indirectly can help protect us from some of these environmental exposures that we're subject to. So things such as air pollution, it can help buffer us from noise and provide places of quietness and tranquility. Moderate temperatures in terms of heat island effect, but also help with flood regulation and enhancing biodiversity. So spatial planning is one of the most significant enablers in the context of both health protection and health promotion. So health protection in terms of some of those exposures that I've talked about there in terms of air, noise, it can help protect us from that. But good spatial planning can also be a health promotion. So the creation of these well-connected, accessible places that include an awful lot of green spaces and blue spaces that the public can access and local communities can access really does have a part to play in creating a more sustainable society and environment. So higher levels of visitation to our green spaces, particularly, they are related to better health outcomes, but also we know that the degree of greening across our neighbourhoods is not equal. So those where there's communities of lower socioeconomic status have less or lower quality green spaces. And there's the quality issue, which I'll come back to later on, which is actually really, really important here as well. So there has been recently enough in the last number of years a new concept, international concept, which has emerged called this 330-300 rule, which it's one of these objective benchmarks to ensure that there's equitable access to nature for everybody within our urban environment. So it stipulates that we should be able to see 3 trees from our home, our work, or place of study, that our neighbourhoods should have 30% canopy cover, and that we should have 300 metres, we should be no more than 300 metres from our nearest public green space or park. So we worked with our analytics unit in the EPA as part of the chapter to just map one of these dimensions in the 300 metres from your nearest public green space in the context of Dublin City. So what we did is we looked at the Dublin City Council park and recreation amenity spaces, and we mapped these at small area population statistics areas to see the residences that were actually within the 300 metres of their local green space. And you can see those that are in the darker colours here, there's less residences within those SAP areas that actually have access 300 metres to their local green space. But again, coming back to the quality, it's not just about the access to your green space. So you can have a green space close to your residence, but it needs to serve the needs of the local community, which is really the most important thing, and it needs to be of high quality. So we need to ensure that the safety, accessibility, the cleanliness and wider service provision within the green spaces actually meets the needs of the local community area. We heard a little bit as well already today about nature-based solutions and the potential that they have to deliver multiple benefits to society. So these are multifunctional solutions which can address a multitude of issues from climate change, biodiversity loss, environmental pollution, but also create greater human health, societal prosperity and urban prosperity as well. So we can see from some of these international reports, nature-based infrastructure solutions can influence 79% of the SDGs, and also 1/3 of the climate mitigation needs to meet the goals of the Paris Agreement can be achieved by nature-based solutions. So we are seeing these implemented in Ireland in a variety of different scenarios. But what we need to see now is really an upscaling and a wider application of them to benefit multiple societal, environmental and sustainable benefits, but we also need to be able to measure them across multiple domain areas. So we need to do this in a long-term way to really understand the impacts of them, and are they having the desired effect, or what are the other accompanying benefits that they might be having to society. So we're not currently really measuring that in a good way. Moving on then to the harmful environmental exposure. So we know from the EEA, we've already heard about this today, 1 in 10 premature deaths in Europe is linked to pollution. And 90% of those deaths are attributed to the environment are caused by non-communicable diseases. So we're not talking about our infectious pathogens here, we're talking about cancers, heart disease, respiratory illnesses, stroke, diabetes, and neurological conditions as well. Here's some of the numbers from an Irish perspective. So Laura had introduced a couple of these in her talk earlier. Air quality still remains the biggest environmental threat to health that there is. So in Ireland, we have 1,600 premature deaths annually, mainly from burning of solid fuels, PM exposure. We have 350 lung cancer cases annually due to radon, and we have over 1 million people exposed to noise levels above threshold levels. So I'm going to let my colleagues Pat and Tony talk about the air and noise aspects, but I'm just going to give a bit of a worked example through the radon example here in terms of these are hazardous exposures which are putting people, I suppose, in Ireland at risk, but they're preventable, they're modifiable. So radon is a radioactive gas it's a natural occurring, the radioactive decay of uranium in our soils and our rocks. It builds up within our houses and our workplaces from the ground. So it's the most significant source of radiation dose that the Irish public receives. So this is research from and work from the recent EPA-HICWA dose report that was published earlier on this year. So it constitutes about 60% of the average dose that the public receives. Importantly, it causes 350 new cases of lung cancer every year. And you can see here the radon risk map of Ireland, which was redone in 2022 and relaunched in 2022. You can see a very high proportion of Ireland is in that high risk radon area, with 1 to 5 homes in the area likely to have high radon levels. Since 1998, the building regulations require that all new houses built have a standby radon sump installed, so this can be activated in the event that there is high radon within the home. But also then for new houses in high radon areas, both a standby sump and a radon barrier is required across the entire footprint of the home. And this is a really key primary prevention measure to stop radon entering that home. So the EPA monitor and look at the levels, the average levels of radon indoors on every number of years. So when we first established this back in 2002, we found that there was an average level of 89 becquerels per metre cubed in the country. We reassessed this in 2015, and what we saw was there was a reduction down to 77 becquerels per metre cubed, and that 13% reduction was attributed to the building regulations and some of those examples that I just gave you there in the previous slide around that. When we actually looked at the homes within that cohort that was assessed post 1998, he had a lower radon level again, so 64 becquerels per metre cubed. And we're actually in the middle of the study at the moment to re-establish what is now the new national average here. But we know from what we've seen already and what we've done to date that primary prevention in terms of radon is really the best and most effective way to protect the population from this radioactive gas. Moving on then just to the third message, which is around unequal environmental exposures. So we know again that there are unequal exposures across society, and we have more vulnerable populations in our society. So we have the young, the old, individuals who are already in poor health, but we also have those from with more disadvantaged socioeconomic status as well. And this is the case in terms of air pollutants, in terms of exposure to noise, in terms of access to public or private water supplies, in terms of access to green spaces as well. And these are just a couple of different infographics, I suppose, just supporting some of this. The first one here is from the EEA, and this just shows the effect of air pollution on children. So they're obviously a vulnerable cohort of society in terms of they take in more polluted air, their lungs and organs are developing, they have faster breathing rates, they're lower to the ground. So all of these factors make them more vulnerable to air pollution. And you can see here some research that was done by a group, it was EPA funded, it was performed with Trinity and ESRI, showed a strong positive association with PM 2.5 and the levels of respiratory item prescription rates, particularly in children. And also they looked at the older cohort as well within this and saw a link between the NO2 levels and the association with asthma prevalence. And also, I'll focus maybe just on this one over here. This was recent research by the ESRI as well that was EPA funded that showed the higher annual average levels of PM 2.5 was associated with higher depression and anxiety in older people. And they showed that this effect was seen at actually quite low levels. So it shows, again, reiterates the point that there's really no safe level of air pollution. So in terms of understanding these inequalities a little bit more, we really need to start looking at this at a finer geographic scale. And what we should also really do is try to increase the visibility of some of these inequalities through existing frameworks, such as the Wellbeing Framework for Ireland, which is really still in its infancy, but it has the potential to bring some of these issues more into the policy-making space, make them more visible, so we can have some targeted and measurable actions within some of those policy areas. In finishing up now, I'm just going to talk a little bit about climate change, I suppose the threat multiplier, as we call it. The climate crisis is undoubtedly a human health crisis, and it can cause a multitude of different effects to us, and it's already having these impacts on a daily basis to our lives. But I suppose the most important one, which I'm going to go into a little detail about, is it's worsening many existing and already significant environmental health hazards. And a good example of this is VTEC. So Ireland, this is a zoonotic pathogen, and Ireland consistently reports the highest rate of this in Europe. We have done since about 2010. And you can see again in 2022 data, this is data from the HPSC, children under 5 and adults over 65. There's a high number of cases there. It can cause a complication called HUS in up to 10% of cases, and that can cause acute kidney failure in children. Untreated private water supplies are one of the most common risk factors, and indeed VTEC patients are actually 3 to 4 times more likely to be on a private water supply or have a private well. When I'm talking about this in the context of climate change, we have evidence now and research to suggest that it is influencing the pattern and also the frequency of this disease. So this is already an issue, but it's going to become more of an issue into the future. One Health approach, I'll finish on this just to say we've already heard a lot about it today. It's not a new concept, it has been around for some time. It's had renewed focus obviously since the COVID pandemic. It is that interlinkage and looking at as the system as one interconnected piece between human, animal and environmental health. And it's really in terms of trying to achieve global health and mitigating the impact of current and future health challenges at that human, animal and environment interface. And you can see there's been a lot of ambition here. The quadripartite organisations have a joint action plan, and obviously Lena had talked about the fact that the 5 agencies at European level have also committed to work towards a more One Health approach in their scientific advice. The environment is core to this. It's a core part of this One Health paradigm. It's often the poor relation. So we really do need to have, it's a critical component of what we need to do. We need to ensure that there's strong alignment with and inclusion of environmental considerations and actions in any national One Health action. Just to conclude, and really this is just leading back to some of those key messages that I talked about. The environmental exposures causing disease and early death are modifiable. We've known about some of these for a very long time. And it's really now time, we're not really making much strides in trying to achieve some of them. So now is the time that we really have to make some substantial change, because we know what to do, we know how to do it. So we just really need to put more action in place to achieve that and protect the public from some of these hazardous environmental exposures they're subject to. We know that the impact of environmental exposures are not equal across society, as I've said, and improving environmental quality can create healthy places for all members of society, allowing for a place where everybody can thrive. Good quality health promoting environments rich in nature-based infrastructure can enable citizens to make more sustainable choices, live healthier lives, and also reduce some of these hazardous environmental exposures that we've been subject to in terms of air quality, noise, water pollution, flooding. And I'd like to end by just thanking all of my contributory authors on this, Alison Dowdall, Brendan Wall, Martin Doyle, Cormac McGarrett and Andy, also the SOA team and all the many internal and external reviewers who I can see in here as well today. Thank you so much for all of your very constructive and helpful comments in the preparation of this chapter. Thank you.